Thank you, sir, for the answer. With this, I would like to ask you, which quality do you think is the most important in a doctor?
I think the most important quality in a doctor is compassion. Knowledge, intelligence is there, but you don't require great knowledge to become a great doctor. If you see outside in the market, thousands and millions of quacks are thriving. They don't even have, most of them, any medical qualification. Villages, half of the people who are but compounders or pharmacists somewhere are doing medicine and practicing and thriving without knowledge. Because patient doesn't know knowledge, patient doesn't know how much you know, patient knows how you treat him. Do you convey that you are concerned to the patient? Patient should realize that you are concerned about his illness and you will take enough pills to treat it. And if that is spiced and fixed with knowledge and clinical skill, you are the winner. But first requirement is compassion and soft skills. If you don't have soft skill, best doctors will not be able to, then you are treating a disease, not the patient. And today this is what is happening, you are treating the disease, not the patient. Doctor is supposed to treat the patient and not the disease. Okay, thanks.
Next, what is the most memorable medical success story of your career so far? Can you please tell us about the best case encounter so far?
This is difficult, there is no end to that. That's very difficult. I think, because it was right in the beginning of my military career, so I will talk about that. It was when I was first time doing the independent physician posting in a small hospital next to MH Jammu. That was MH Aknoor, 170 MH. And on one fine day, I do remember that date was 27th, I think, of June. In the evening, there were few cases of food poisoning. That is what I was told. That there were cases of food poisoning from an officer's mess. Around 13, 14, they were vomiting. They were brought in. And so, normal case food poisoning is a minor thing. But then, by the time I reached the hospital, which was maybe 15, 20 minutes, all 14 were in coma. They were having deep breathing. And they were all lacrimating, salivating, skins all soaked. And I was totally zapped as to what happened to them. Because which food poisoning can do that so quickly? Last food taken at 3:30, symptoms started at 4. They were having a picnic and 5, one child died. 5:30, all this is happening. This was the sequence. And then I smelled kerosene and mineral oil, and then I realized that in nutshell they were all having organophosphorus poisoning. That was mixed with the food in a picnic in an officer's mess. So officers, 2 of them, ladies, children, youngest child 5 years, 3-year-old died on the way. There were 14 only. And that war footing started in a small hospital of 70 beds. We got doctors from our nearby field hospitals and ours. I was up on my feet for next 24 hours, circulating between patient and directing injections because we didn't even have infusion pumps at that time. I'm talking of 87. In one night, I had given 1,500 ampules of atropine to these people. The pyridoxine was not available. I had to ask him from Delhi and from Udhampur. I got atropine from Jammu, from Udhampur. Final came from at 3 o'clock in the night from medical college in Jammu, 200 odd camps. Commandant of MH Jammu brought it. Sir, this is the last thing. Now, God bless. And there is one thing I can say, all of them survived. Nobody died. And There was an inquiry and all, but those 14 people somehow survived. 2-3 of them went on ventilator, but they survived. I later on got a chief's commendation for that. But the main reward was they survived. That was the main reward.
That was really very fascinating story, sir. I would like to ask, how did you come up to a conclusion of pursuing medicine as your specialty? What influenced you and how were you so sure?
Why did I come to general medicine? Oh, that was, yeah, that is a very tough question. And it was because of my wife, late wife, that it happened. As luck would have it, in my college I was getting all subjects. And I never wanted to do medicine. So I wanted to do something. Surgery, people were asking me, join surgery, LTI, this, that, everywhere. I have no disrespect for all any discipline, please. I have full respect for all disciplines. But I was thinking what to do, and the last date of submission was there, and then my wife was, what is your problem? Why are you dilly-dallying? Just do it. So I said, I can't decide what to do. And then she says, what do you want? I said, I want to be known as a good doctor. So she said, so which subject you will become a good doctor? And then I thought and I realized the comprehensive medicine is only medicine, and for young children, pediatrics. So medicine is the answer. Where? Because you cannot say, this is not my patient. Every patient is your patient in medicine. You see, patient of headache comes. And what happens? You send that patient to reflection. Nayak madam says, no ophthalmological cause for headache. You send him to ENT. ENT says, no ENT cause for headache. You send him to psychiatry. He says, no psychological cause. You do MRI, no surgical cause for headache. Can you say there is no medical cause for headache? There is medical cause for headache, isn't it? So he is always your patient, first and last. You are the center point. And that is why if you see in any medical college, if medical OPD is not 1/3 of the total hospital's OPD, there is something problem. Every patient must come to medicine, go from medicine. Surgery, there will be hypertension, diabetes, anything. So medicine, and I will do it again. Medicine only. Yeah.
So with this, sir, what what do you enjoy most about being a doctor and what do you like least about it?
There is nothing that I don't like about medicine. But yeah, what I like most is that you can reduce suffering of the human being. That is what I like. That you can reduce suffering of the human being. That is the only one profession that you can do. In other professions, you can give comfort. Right? If you design a car, you have given comfort. Medicine is the only profession where you can reduce suffering of the other human beings. You can make them feel better. So, medicine. And what I don't like, probably what I don't like is now medicine has become very defensive. Thanks to all laws and regulations. Today's medicine is defensive medicine. People are afraid. That's why even if I know that the patient has got a myalgia, but everybody will say, why have you not done angiography? Because you are defensive now. Some regulation, somebody will catch you, somebody will take you to the court of law. So the human touch is going away from medicine because of that defensive medicine. When the patient had faith on the doctor, there was family doctor, and family doctor said, that's fine, carry on. Everything was fine. Today, the Google auntie will teach you so many things. So you go into Google and you think, why? MRI तो किया ही नहीं, कोई assault निकला है, फिर क्या होगा? So that is why defensive medicine I don't like. That it takes human touch away from medicine. Yeah.
So next, in the rapidly evolving field of modern medicine, what challenges do you think stands next for newly practicing physicians?
Because of the development, people have lost touch with the basics. That is the main problem. Today's doctors are more concerned, students, more concerned about reading coachings, MCQs, NEET. They have just lost the idea they are here to become a doctor. They are supposed to be reducing patient suffering. Rest all will come in time. But they don't see the patient. They do only NEET, they do only MCQ, they do only coaching. I will tell you today, all the students sitting there, in how many of them have read Hutchison? You ask. Can anybody raise a hand? How many of you have read Hutchison? One I think, one I saw somewhere. Is it one? We went to California and we went to Napa Valley where the 4,000 years, the oldest trees on the planet are there, 4,000-year-old trees, the same General Muir's Observatory. So that is a wonderful thing. Like you see, those trees are 300-400 feet in height. Girth is like size of room, and that tree has been the grizzly, the old grizzly it is called. It has been there probably for 4,000 years. And you feel so humble standing there among them. Do you think you are a big shot? You are nothing. Look at this. They have survived 4,000 years and they are still there. So one of those. Otherwise, all the countries are good. Switzerland is very good. I mean, yeah. There is no end. I can keep counting. They are good.
So we would like to know more about your family. Where did you meet your wife? Was it an arranged marriage or love marriage?
It was very much arranged marriage. I told you somebody was trying to commit suicide by taking alcohol. And I also told my parents that you decide whoever you want me to meet, I will say yes, you decide. Because a human being is not a commodity that you can say I don't like. So if I meet, I will say yes. So that was it. So I met only one lady and my
Sir, please tell us about the 3 most influential people in your life and how they influenced you.
Current influential person in my life is Sadhguru. he is there now. But one of the very, very influential people, I still am a student, was Professor Ram Singh, under whom I did MD. I have yet to find a clinician like him. And whatever we may do, Professor Ram Singh, God rest his soul, was the ultimate clinician that I have seen. So he is one person I admire, worship. In Army, Admiral again a neurophysician, a great friend, great guy, excellent. He was here for neurology update. Excellent clinician, excellent human being. So I like him very much. My friend is sitting here, I won't name him. I am guided by him also, a close friend. So now there are a number of people. That's why if you see, you did not put it, on every teacher's day I say, everybody is my guru. You have to learn from everybody. So that is what is my way. You keep finding faults, no, finding good in everyone, you can learn from them.
So if you could go back and give your 18-year-old self one piece of advice, what would it be?
Don't waste time in reading novels, study more. I can tell you today that I used to study regular. Yes, even that we will do. Today we do it regular. But I could not study the day before exam ever. I used to read novels. What will you read? You write or whatever you want to read. What will you read the day before exam? You can do nothing. So stay relax. But yeah, I believe if I was more passionate about and sincere and hardworking in studies, I should have been not in SM Medical College, I should have been in probably AIMS or done something more, I don't know. So I would say yes, I wasted a lot of time in playing games and all.
Sir, what was the most significant turning point in your life?
That's a tough one. What is the turning point in my life? There is no turning back. So why there is a turning point? I have not yet turned back. I am carrying on and on. We will continue. But probably the turning point was, I think, my joining army. Because in my family, nobody had been in army before. Nobody out anywhere. And I decided to join army, and there was the resistance to why, but I joined, and I think that is what shaped what I am today. So I would say that was the main.
So, what was the most happiest and most saddest moment of your life?
Happiest moment of my life. Maybe that I got. I don't know. I've been happy. I like to be happy all the time. You have seen me. So I don't know. But I mean, even if I am scolding people, they know outside that is fine.
You can share premarital figures.
Yeah, I did. So somebody tried to commit suicide. So that's why I decided no point in that. So, happiest. Everything has been happy in life. Why bother? And there is saddest moment I can say. Maybe I can say when my wife was diagnosed as cancer. And it was out of the blue that it came. And she had one of the worst type of malignancy. She had a cholangiocarcinoma of CBD, poorly differentiated scarce variety. And when she was diagnosed out of the blue in 27th of May 2015, it was actually dumbfounding and shocking that it occurred suddenly. I got an ultrasound done just 2 months before that, and everything was fine. So it was shocking. But then, that is how life is, no regrets. I and she, we promised one thing, that I will do whatever possible for her. There will be no regret that I could not have this one thing more. We decided. And we will live life. No going back. We will do, she knew, she said, you will do whatever is best for me, I know. But let's live life, otherwise I will die every day. So, 21 months she survived after that. And Brigadier Srivastava was there, and all of my friends were there, Dr. Nayak was there. So they saw. But fine, you have to fight it out. If you lose some, you win some. So probably that was the saddest.
So to add fun element to this conversation, we have a rapid fire round. So we hope your answers would be rapid and full of fire. So 3 books that you absolutely love and would like to recommend all of us.
3 books. One is Hutchison. Second, Davidson. And third, Harrison. But apart from that, if you want to know, you want to read, so one of the good books is Seven Habits of Great People, right? That is one book which you should read. And apart from that, I keep reading a different kinds of books. I read into spirituality and science. I like to read that. Science and spirituality. One of the very good books I read was The Brief History of Time by Stephen Hawking. Another very good book which still is lying with me is Tao of Physics by Fritjof Capra, the Nobel Award winner, who has compared Eastern mysticism with nuclear physics. And it is a fantastic book to read. So the number of books, but yeah, if you ask me best 3 books, Hutchison, Davidson and Harrison.
What is your favorite cuisine?
I am an international eater. I have no favorite cuisine, but still, if you ask me, I would go with the Italian.
The 3 movies that you love and admire.
Yes, Interstellar. Interstellar, one of the mind-boggling movies that I have seen. A man who walked the earth. I don't know how many have seen it. The Man from the Earth. It is a beautiful movie. It was created around 40-50 years back. But it is a fantastic movie. You should see. It is about a human being who apparently does not die. But he is human. And he is just having conversation in a room with his friends and colleagues. And how it unfolds. So Man from the Earth, one movie, Interstellar is another fantastic movie. And I would say, otherwise you'd say I am not, I am anti-Indian. I think Three Idiots was one of the good movies.
What is your biggest fear?
Fear. Fear is that I may not get up in the morning next day. That is the only fear. That if you don't get up, what? But then I say, if you don't get up, let others bother about it. Why should you bother about it?
Your one favorite thing about yourself.
I'm inquisitive. That is one thing. That's all. Inquisitive, I will not rest. Brigadier Swatar knows, Brigadier Khare knows. I will not rest till you reach the end of the damn thing. You keep, even if it takes 3 hours, 4 hours, I will keep working on it. Yeah, I'm inquisitive.
So one person from our campus or hospital who made this long journey easier and worth living.
Every one of you. Everyone. I will go entirely wrong to say if I single out one person. Everyone. And that is why I continue to be here. I wanted to go, but I am grateful to all of you that I am still here. So, everyone. There is no doubt on it. I cannot single out any one person. They are friends. Because if I say Brigadier Srivastava, Brigadier Khare, Dr. Varan, we spend more time together. That's fine. Right? That's fine. Because we are in the same department. So, we spend more time. But the environment is made not by 2 people or 1 person, it is the entire setup. And everybody is so good. Yeah. Everybody.
So, who is your all-time favorite resident?
Okay, I would say that the favorite goes with the quality of hard work. If you ask me the favorites, so there are a number of them. And in fact, you see, these juniors are sitting here, first years.
Yes. Yeah.
They are sitting there. Sit. Today I should thank you because they have asked me. If I kick your butt, it is because I am worried about you. If any of the teachers shouts at you and kicks you, it's because we are concerned. If we couldn't care less about you, you go to your way. That's fine. But if teacher is scolding you, that means he is concerned. So you are his favorite. That is why he is concerned about you. Right? That is why he is shouting at you. But yeah, I had a favorite ex-residents, if you say. One of them, those 3 are sitting there. Otherwise, Vikhe Jariwala, who got the gold medal, university first. Mukul, who was doing very well in Nawashahar, Punjab. Mukta, she did within 1 year of passing her MD here, she did MRCP and DLP both within 1 year of passing from here. So she did that. So there are a number of them. But everybody is a film. Everybody is a film.
With this, let us move towards the end of our interview. What advice would you give to our future generation to remain mentally stable?
Believe in yourself and work hard. And remember, this is for everyone. The basic, whenever you are working, you are sitting here and you have to work because you have become a doctor, you have come into the profession, or you are in any profession. The basic premise is, the basic saying as it goes is, work hard to get what you love. Otherwise, you will be forced to love what you get. So if you work hard now, your life is set always. If you work hard, be sincere to your profession, be respectful to your patients and your teachers, you will get what you love ultimately, right? And everybody wants a life of comfort. That is what you love. So work hard to get that. Otherwise, you will have to love whatever comes your way. So better work hard and do well. All the best. Yeah.
Now, I would like to conclude our conversation with a question. We would like to conclude the conversation with a question which everyone over here would like to ask. Recently, we celebrated your 69th birthday, and even at this age, you have this charisma and aura around you by which everybody is amazed. So what is the mantra behind such a joyful, cheerful and optimistic life? Or I may ask, what is the dance behind all this?
First of all, thank you for telling me that everybody is impressed by my charisma and whatever they said. I don't know. But the mantra is be positive. Yes, life is a gift. Live it. You see how many lives you get. One. Thereafter you may believe in afterlife. I don't know if there is afterlife. This is the life. Enjoy. Be happy. Why waste even any time in brooding and wasting it? So go ahead and do it. And second thing is, if you want to do well, anything, you need a good vehicle to do it. And your body has to be maintained. So unless you do exercise every morning and the swimming that I took, by the way, swimming I took after 65th birthday of mine. So before that I never entered a swimming pool. I started after 65 years of age. So now you keep yourself fit, you are happy. And fitness also keeps you happy because fitness is an endorphin secretor. So you do work out, more endorphin, more high you are, so you remain high on the chart.
Thank you, sir.
Thank you very much. I am honored everyone for having taken your time.